Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's the topic is about third-party reporting. We are so pleased to have Jaymie Sorro. She is the counselor and coordinator of the Sexual Assault Crisis Program at the Klinic Community Health Center with us today. So we would like to begin by acknowledging that we are on Treaty 1 territory, the traditional territory of the Anishinaabe, Greek, OG Greek, Dakotas, and Denise peoples, and the homelands of Native nations. And we respect the treaties that we were made on these territories. And we acknowledge that we are all treaty people. At the Occupational Health Center, we commit ourselves to our process of reconciliations with indigenous communities. For your participation of this session, please, put your question on the chat area. So Jaymie will try to answer that at the Q&A session. So you see that this session is being recorded. We are going to share on the social media and our website. And the slide of the PDF version will be shared later too as well. So, and if some of you doesn't know about Occupational Health Center, we are now located on the 167 Sherbrooke Street, the same building with the clinic together. So we are the community health center funded by the Winnipeg Regional Health Authorities. We provide the services to the Manitoba workers with work-related health issues and work closely with the Joint Workplace Health and Safety Committee for training and other resources. So all our services is free. So please visit our website for more information. So now please join me the time to welcome Jaymie.
Thank you so much, Tiffany. Welcome and good morning, all. Today, like Tiffany had mentioned, I will be talking about third-party reporting, specifically with the Sexual Assault Crisis Program or the SAP program here at Klinic. So just a little bit about myself. So I'm a counselor in our program. So I do longer term counseling within the Sexual Assault Crisis Program, as well as my main role is the coordinator of the SAP program. So following this presentation, I hope that you will have an understanding of what third-party report is, how it can be an option for individuals who are considering telling their story, where and who you can direct someone to access third-party reporting, and the process an individual goes through to make a third-party report specifically with Klinic. So before we kind of dive into what third-party reporting is, I first kind of wanted to go over the general reporting options that are currently available for folks. So for example, if a survivor does not want to speak to police, they do not have to have police involvement at all. So a person impacted wants no involvement with police at this time, that is totally okay. Another option is a formal police statement. So a statement can be made to the Winnipeg Police Service, and this statement is dealt with by the Sex Crimes Unit, where the survivor can do a videotape formal statement, and that is if they are considering charges against the offender. And the other option is the third-party report. But what I do want to highlight is that there's no limitation on when a person can report. So for example, if this is something that's historical and has happened a few years ago, this does not mean that the person cannot move forward with making a report to police. So what is third-party reporting? So on April 6th of 2018, third-party reporting of sexual assaults became available in Manitoba. So the SAP program here at Klinic partnered with the Heart Medicine Lodge at Kanikanechik, Sage House at Mount Carmel, and the Winnipeg Police Service earlier that year to develop a standardized third-party reporting option for survivors of sexual assault who are ages 16 and up. At the same time, Klinic also partnered with the RCMP so that the third-party report, or the TPR, could be accessed all across Manitoba. So more than 60 have been completed since 2018, and we have done already quite a few this year alone. So, what is third-party reporting? So, simply put, a third-party report is reporting options that allow survivors of sexual assault who are 16 years or older to remain anonymous to police while still having the opportunity to provide information about the crime and the offender. So, it is important to note, though, that this is not a substitute for a formal statement or a formal report to police, and the purpose is not to result in a police investigation. So if the survivor is contemplating charges or is hoping for an investigation, that would mean that they would need to complete a formal report with police. So to complete a third-party report, a survivor first needs to connect with one of the community agencies that is set up to take a report. There are currently 4 here in Winnipeg. A worker can then support the survivor as they can complete the TPR, and this could be done over the phone or in person, but we typically encourage folks to come in person. The worker then discusses the process with the survivor to ensure that the information that they're wanting to present basically meets what they're wanting. So if they're not wanting to speak to police or wanting to remain anonymous, they don't want an investigation, we ensure that that is covered in this initial conversation with folks so that it kind of meets what they're wanting. So if the survivor chooses to continue, they'll fill out 2 separate forms. So one is what we call the cover sheet that has the person's information on it. So it asks for their name, date of birth, basically kind of their demographic information. And this is what we keep as an agency. So this is never provided to police. And the second is the one that collects information about the sexual assault. And this is the piece that is forwarded to police. So the second form, or the third-party report, basically asks for information about the victim, the offender, as well as the offense. So it is important to note that the questions that are being asked around the third-party report are not meant to criticize, offend, or blame the survivor or for any parts of the sexual assault. They're basically asked to gather as much information about the incidents as possible. But also the survivor, though, has the option to skip any questions. So as they're going through it, if they don't have an answer for it or they choose not to answer it, they can absolutely leave that part of the third-party report blank. And as the person is going through this, the worker can provide emotional support during the process as well as after the process, as well as answer any clarifying questions. So what happens to a third-party report when it's submitted is that once the form is complete, the agency will link the 2 forms with what we call an agency file number. So, and we send the form without the survivor's identifying information off to the corresponding police agency. So whether that be the Winnipeg Police or the RCMP. So once the RCMP receive this report, the police will generate what we call a police report number. This police report number can then be shared with the survivor. And what this can do is that if they ever do decide to move forward with a formal statement later down the road, they can absolutely use that police report number to link their third-party report to their formal statement. And additionally, what survivors can also do is that they can apply to the compensation through the Victims of Crime program. So an example for that would be if they attend the hospital and are provided some medication, some prophylaxis, or as well as emergency contraceptives, as well as medication for HIV. That medication can be covered by the Compensation of Victims of Crime program, as well as if they're wanting to seek counseling, that program can also help with that. So what happens though is that if that information gets sent to the Winnipeg Police, it is shared basically with the police community for informational purposes. However, if there's enough information in that report, it can be entered into the Violent Crime Linkage Analysis system, which we call VICLAS down there. VICLAS is basically like this national database for tracking violent offenders and offenses and the offenses that they commit. So the police will not interview the offender or witnesses that are identified in a third-party report, as doing so could potentially jeopardize the safety of the victim as well as their anonymity. So if the police at any time want to follow up with the survivor, typically on the third-party report, there's a question there that asks, like, if the police are wanting to speak to them, are they willing to speak to police? Survivors can write down whatever they choose. However, if the police are wanting to get a hold of them, they will first contact the community agency that has the agency file number to request to speak to the survivor. So then a worker from the agency will then follow up with the survivor, at which they can then choose to speak to police at the time, or they can continue to remain anonymous. So there's never any pressure on them to, like, for example, if the police, like, their kind of flags are raised around a certain report, they'll first reach out to us. And there's never necessarily any pressure for the survivor to provide the information. Except for when there are exceptions. So I'm going to be going into the exceptions now. So the way I kind of discuss the exceptions is when I discuss them with the survivor, I typically talk to them about how it's the risk to the anonymity. So when we talk about the central tenet of third-party reporting, it's that the survivor wishes to remain anonymous to police. So they don't want police involvement. They don't want to speak to police at this time. So in this grander context, the police are then responsible for treating the information contained in the report in a sensitive manner so that we don't out the victim. So they do this by not making any investigative inquiries that might identify the survivor or or alert the suspect that they have been the subject of a third-party report. So as previously mentioned, though, doing so could potentially put the survivor's anonymity at risk, as well as for further harm. However, in the context of domestic-related sexual assault or intimate partner violence, there is a mandatory investigation policy. So police are mandated to proceed with an investigation whenever they become aware of domestic violence or intimate partner violence. So if a third-party report indicates that a sexual assault occurred or was perpetrated by a partner, the police will then be mandated to move forward with an investigation, which could potentially put legal pressure on the community agency to disclose the identity of the survivor. So police will only investigate if they are aware of the assault occurred in a partnership. So again, like I had mentioned before, the survivor has the right to leave any questions blank in a third-party report that they do not wish to answer. So one of the questions include, how do you know the offender? The person could choose to leave this blank, as well as they also have the option to write a narrative about what happened. They could also choose to leave that out. So again, that's the right of the survivor to put what they feel comfortable in that third-party report. But again, if police become aware, then there's a mandatory investigation needs to occur because they do not tolerate domestic violence. So additionally, so if there was a reason to believe that there was a specific person that was in immediate danger, death, or serious bodily harm, police would also need to become involved. And this also includes the abuse of a child, which becomes then a child welfare issue. So our workers are mandated to report any child welfare issues that they become aware of. So anytime a minor, so anytime under the person who's under the age of 18 has been sexually abused or sexually assaulted, a report must be made to Child and Family Services. This is even true if the offender is also a minor. So this is just because Child and Family Services wants to be aware of the person within the community who has harmed a minor. So again, for example, we had mentioned that the third-party report can be filled out by folks who are 16 and older. If a 16-year-old does come to me and fills out a third-party report, I must report that to Child and Family Services. And I have a discussion with the person around that as well. That is always kind of upfront, just so that they can make an informed choice about how they would like to move forward. Their identity, though, can still remain anonymous on the police report. The reason why there's a risk to anonymity is that if CFS becomes involved and they do their investigation, that could potentially mean that they will be interviewing folks. And again, that is another risk to the survivor's anonymity. So however, though, if an adult is making a report for an assault that happened to them when they were a minor, so we call these historical assaults, we typically do an assessment to determine whether the person who has harmed them has currently access to children. And what that kind of looks like is that we explore, does this person have a greater capacity or a greater access to children than the average adult? Because when we think about it, we all kind of have access to children, whether we're walking down the street, walking past a school, but does this person have a greater access to children now? This could mean like they're a teacher, a coach, any kind of in that kind of capacity. So if so, then a report must be made again to Child and Family Services. So additionally, if as we're talking and the person is filling out the third party report and they disclose that a minor had witnessed the sexual assault, or the person who has experienced the assault is unable to care for a minor as a result of the sexual assault, a report would also be made to CFS. And this is again just to ensure the safety of children and to get support for those folks. So now we're going to go into why we have third-party reporting. So the following slides are basically going to delve into why third-party reporting was established. But before we do that, I am going to show a video. I do want to say that there's a content warning here that the following video on the next slide will talk about real accounts of sexual violence. So what I'm going to do is I'm just going to stop sharing my screen for a second and share the video. So again, this video tells us why they didn't report their sexual assault.
I was 22 when I was raped.
I was 19. I was 20.
I didn't report it for, 1,000 reasons, a million reasons.
It was somebody I was involved with.
It was a friend of a friend.
My drug dealer.
Met this photographer by myself.
I got very drunk. I met some guy in this bar.
He started trying to kiss me and I said no.
He takes my left leg and raises it on his shoulder.
He went to put his hand in my panties and I tried to kind of deflect his hand, and that's when he slapped my hand away.
I blacked out.
I was fighting like pretty hard at this point, just saying no, please don't, please don't.
I came to.
Internally, I was shaking. I was really trying to look as calm as possible.
I could tell that something that I hadn't wanted to happen happened.
He held me down and he forced himself inside me.
I was being pleasant and nice just so I could remain safe and get out of there.
And I kind of just ran out into the street with like my pants on inside out and my shoes off.
And he sat up and he looked at me, and that was, I guess, the scariest moment for me, because I could tell he was deciding whether he was actually going to stop or not. And that was the moment that I realized that I had thought I was in control of a situation that I was not in control of at all.
And I blame myself for putting myself in that situation.
I knew that I had no proof.
I could hear people's judgment saying, well, why did you do that? It was your fault.
I was still in like physical pain from this and sitting there going, oh, well, no one's gonna believe me.
It was my word against his.
Everyone was just gonna go, this girl just, slept with this guy and changed her mind.
I wasn't the perfect victim.
I figured, who's gonna believe some cokehead college girl?
I didn't like try to fight him off, or I didn't slap him around, or, I didn't pick up the phone and call 911.
I didn't know that I was important enough to draw boundaries around what people could and couldn't do with my body. Who wants to come forward with the literal most violating thing that can happen to you, relive it, and then have people telling you that you're making it up?
And I thought I would just be better off trying to put this behind me.
I couldn't imagine pressing charges and then having to sit in a courtroom and look at his face over and over.
I thought, well, you know, that's like giving him what he wants. Like, I'm spending more time on him or spending more energy on this.
I imagine, and I think rightfully so, that it would have been more traumatizing for me in many ways had I reported it.
It's up to a survivor to decide what they do with their story. It's up to them if they want to report it or not.
I don't want this to be a part of who I am.
I hated myself a lot at the time.
We are violated, we are harassed, we are touched, we're trapped, we're scared. And we just take a chip on the shoulder and we keep our lives going, and that's not fair to us.
And I think it would be wrong to tell them that they don't get to decide what happens next.
I was
Oh, okay, so I know that video can be quite heavy, so I just kind of want to give everyone a little bit of a pause to take a couple of deep breaths to kind of settle in. Um, but yes, these are real life accounts of why folks do not report sexual assaults, because there are a lot of heavy feelings associated with them, a lot of stigma. So kind of moving on to the next slide here. Oh, sorry. So why do we have third-party reporting? So in Canada, only about 5% of sexual assaults are reported to police. We have identified and people have expressed to us that there are a lot of barriers to accessing legal support for Indigenous and other BIPOC folks that make reporting or speaking to police very difficult and can be very re-traumatizing. So the third-party report offers survivors another option to be able to share their story in a way that feels safe and comfortable for them. So the third-party report provides an opportunity for a survivor of sexual assault to be able to, again, share their story and receive validation from a trauma-informed response. So it gives them access to emotional, psychological, spiritual, and cultural support as they're navigating the healing process. And again, just because someone chooses to do a third-party report now doesn't mean that they have to doesn't mean if they choose to do a third-party report now, doesn't mean that they can't do a formal statement later down the road if that's something that they choose, and folks at Klinic are able to support them through that. And again, the details of the assaults will be tracked by police and may be helpful to identify patterns of assault. So now we're going to move into how a survivor again can access third-party reporting. So I know we kind of did a general overview of that, but now I'm going to go into a little bit more detail and who folks can reach out to for support. So again, I would just want to clarify that when we talk about third-party reporting, a common thing that people can get mixed up is that they feel like the third party could be like a friend or a parent or a partner can do that on their behalf. The third party is the agency that they're going to be seeking help from. So for example, if they're reaching out to Klinic, we are the third party that is going to be reporting on their behalf. So within Winnipeg, if the sexual assault occurred in Winnipeg, survivors can complete a third-party report with the Sexual Assault Crisis Program here at Klinic, and they typically do it with me, as well as Heart Medicine Lodge, which is at Kanichik, Sage House again at Mount Carmel, and Pluriels, which it can be done in French. So we typically encourage survivors to, again, complete the third-party report in person if at all possible. And that is just because we want to make sure that the report is within that person's own words and that it can be quite emotional. We want to be able to be there as a support. However, we absolutely recognize that there can be a number of different barriers that may prevent this from being possible. Some examples that I've encountered are the assault happened in Winnipeg, but the person no longer lives in Winnipeg, so they may be in a different province. So of course, we would be able to do that over the phone with them. Sometimes people live rurally and aren't able to come into the city. And sometimes people just do not have access to childcare. So of course, we would be able to do that over the phone with them. But we also express that the process can be triggering, and therefore we encourage people to take things slow. We typically book out an hour for folks, and we always say we can definitely go over if needed, just because we know this process can get quite emotional. And again, if the survivor is wanting to do the third-party report, that would be done with me. So in rural areas, if the sexual assault occurred in a jurisdiction that is policed by the RCMP, again, survivors can complete the third-party report over the phone. And if the survivor is willing to, they're welcome to complete a report in person at Klinic. And again, if it's policed by RCMP, they can do it at the Heart Medicine Lodge or Survivors Hope Crisis Center, which is the northeastern in Manitoba. But currently, the RCMP has only identified Klinic as a sole partner for the third-party report, and that is to ensure that the third-party reports are kept together and that there are not multiple agencies to liaise with. However, we want to acknowledge that there's importance of having different options for folks as much as possible, and we want all survivors to have access to completing this report with someone in person. So for example, if someone does decide to go to Klinic or the Heart Medicine Lodge to fill out the report, they're absolutely able to do that, as Klinic is an Indigenous-led organization that offers that cultural healing and support. So if someone is more comfortable doing that, they can definitely do that. However, Heart Medicine Lodge and Survivors Hope would have to forward their reports to us, and we submit it to the RCMP. However, for example, if it was policed by the Brandon Police, folks have the option of going to the Women's Resource Center as well as the John Howard Society. So we have the ability, however, to partner with different agencies across Manitoba who would like to offer this reporting option at their agency, as long as we house the form and complete all the follow-up with the police that may arise from the report. So if there's any other agencies who are interested in speaking about a partnership, they're absolutely able to give me a call and we can definitely discuss that further. So I want to talk a little bit about the process at reporting at Klinic. So typically what happens is that people might hear about third-party reporting, whether on social media or maybe through a news outlet, and they're typically directed to our crisis lines, or specifically the sexual assault crisis line. What happens there is that the person will discuss with the worker on the line that this is something that they're interested in. They'll have a little bit more information. And again, our workers will definitely discuss the different caveats. So the mandatory investigation with regards to intimate partner violence, caveats with regards to reporting to Child and Family Services if they're a minor, and basically any kind of things that go along with a third-party report. If the person is interested, they're directed to call the SAP coordinator, which is myself, and they're directed to call the 204-784-4049 number, and they're encouraged to leave a message with their name, their number, the best time to reach them, and that they're wanting to fill out a third-party report. Typically, I get back to them within the day, probably max 24 hours. What I do is I then call them back to talk about the third-party report, again, to explain the risks towards their anonymity and to ensure that the TPR is meeting their expected needs. So they're given this information multiple times to ensure that they're being informed so that they can make the best choice for themselves. So we book a time to do one. And again, we typically book in an hour, but sometimes it can extend beyond that. And that is totally okay. Everyone reports, fills out the report a little bit differently at their own pace. And again, I always offer to have some time at the end to talk about how this felt for them, what this was like, as well as any type of resource navigation. And the time frame on when to book one can actually really vary. Like sometimes someone will call one day and we can book one as early as the next day if I'm available. But again, that's always dependent on what the survivor is needing and what their availability is. But typically there is not a long wait to fill out a third-party report if someone is wanting. What then happens is then I will wait a few days before submitting it to the police. And the reason why I do that is, one, sometimes when someone fills out a third-party report, after maybe like a couple of days, they realize that, they don't want to do that, or they don't want to share their story just yet. And that is totally okay. They just let me know that. and I don't submit it for them, or I don't submit it to the police. So that gives them still the option if they decide to change their mind. I also do that. I also have this waiting period just to allow folks, if anything comes to mind and they would like to add to their report. So they'll call me up and say, you know, there's a certain detail I would like you to add. And what I do is I add that into the report. And again, so what I just tell folks is that I will be submitting their report 3 days following their time meeting with me. If I don't hear from them by that time, I move forward by submitting the third-party report portion to the Winnipeg Police. So then what happens is that once I submit that to police, there is a little bit of a waiting period there. It can take up to 5 business days, sometimes a little bit longer, depending on what is going on over there. But basically what happens is that they will provide me with a police report number. I can then call the survivor back because I am the one that has their demographic information or their contact information, and I'm able to provide them with that police report number. And during that phone call again, I talk to them about some of their options with regards to the compensation of victims of crime program, or maybe other resources that they were wanting during that initial meeting. So again, there still is a lot of work that needs to be done to get all communities and policing areas on board with the third-party report. If someone is wanting to complete a third-party report for a sexual assault that occurred in an area that is policed by any above agencies, they are more than welcome to complete a third-party report with Klinic. We can attempt to engage the appropriate police force. If they are unwilling to take the report, we can then attempt to forward it to the nearest RCMP detachment, who may still be able to enter into the Y-class system. If no agency is willing or able to take the report, Klinic can house that TPR and forward it to the appropriate agency if and when a TPR system is set up in that area. So again, in these situations, an incident report may not be populated, and the compensation for victims of crime has shared in these instances, a survivor could still apply for compensation and would just need the agency to confirm that a TPR has been completed. So we still definitely want to provide folks with that option and that information. So again, the compensation of victims of crime program applicants applying with a third-party report are eligible to apply to counseling or culturally based services. This could also cover travel costs. For example, if the applicant needs to travel outside of their community to receive these services, and for pre-exposure prophylaxis medication or HIV medication, which is required following a sexual assault. So again, we want to note that an applicant will not be eligible for the compensation of victims of crime program if the crime has occurred in another province, or if the applicant has a serious criminal record. So if someone has any questions about their eligibility, they are absolutely more than welcome to call the compensation for victims of crime program. So these are kind of the phone numbers and the things that people can access. So basically these links down here, the applications for the compensation of victims of crime program are available for download on these websites, as well as they're welcome to call them directly. So typically people ask, like, how can I help? So a big part of how folks can help survivors of sexual violence is to basically become informed. So we provide public workshops that are facilitated by Klinic counselors around sexual assault awareness and how to compassionately respond to disclosures. These workshops do come at a cost, and the dates are available on our website, and folks can register. And again, this is available to the public. Also being curious, right? Exploring what the person would like to do. If someone has disclosed to you, getting them to kind of to lead the discussion and explore, and you can even kind of direct them to the Klinic crisis lines to be able to discuss that further. And again, direct them to the appropriate resources. So whether that be accessing the sexual assault crisis line to talk more about it, to direct them to me to book that third-party report, or to direct them to any of the other agencies that are able to provide that information. Okay, so I think I am finished a little bit early, but I do want to ask if there are any questions that folks have about third-party reporting. So I'm going to open up the chat here, and I'll give folks some time to type in their questions. Thanks, Karen. So Karen has a question. Is interpretation in various languages available for third-party reporting? So I can't specifically speak for the other agencies that are involved, but here at Klinic, we have access to the language access interpreter services that the WRHA uses. So if someone is needing over-the-phone interpretation, we're able to set that up. Or if they come in person, I can quickly set it up using our phone system here to be able to access that as well. Currently, the forms that I do have are in English, but yes, we can, if that's needed, we can do that. So, oh, no problem, Karen. Okay, so Melanie has a question. If a client that lives rurally around the Brandon area belongs to RCP, not Brandon Police, can they still complete their TPR with the Women's Resource Center or John Howard, and it would just go to RCMP, or do they have to go through Winnipeg by phone for the RCMP access? That's a really good question. I think it kind of depends. So if it does belong to an RCMP jurisdiction, then they typically can just do it here at Klinic, and then we would forward it to them. So anytime it is handled by the RCMP, like there's a specific jurisdiction around it, they could access, again, Klinic, Heart Medicine Lodge, or the Survivors Hope Center, but all that would come to us. Does that answer your question, Melanie? But I think they could always ask too. I think those organizations are always welcome to questions. So yeah, if someone is a little bit unsure, they're absolutely welcome to ask. Leanne. So thanks, Leanne. So in summary, third-party reporting is to help the survivor gain closure and to give them resources to heal. It is not meant to be used to help prosecute the offender. Although depending on the situation, the report may be used by police to help them in investigation. Is that the correct to summarize? Yes, yeah. So it's basically an option for folks. If they don't want police at the time, they're able to gain access to an organization like ourselves, and we kind of help them navigate that process. And yes, you're right. Depending on the situation, the report may be used by the police to help them in an investigation, and that is that VI-class system that we were talking about, because police agencies across the country are able to access that system. Melanie said, okay, thanks. Yes, many of our people in surrounding Brandon towns like services in Brandon. Thanks. Of course. Mohammed, if a person or organization wants to set up an information workshop, would Klinic be in a position to facilitate? If it's like, for example, similar to this, like doing an information workshop on third-party reporting, yep, you can absolutely reach out to me and we could facilitate this. Any type of public education request, typically there's like a information email on our website that folks will email, and it gets directed to the appropriate person on our team. But if you're wanting public education specifically that is around the sexual assault crisis program or sexual violence, that typically gets directed towards us, and then we discuss it as a team if we're able to accommodate that. So Lorraine has a question. Do the nurses in the emergency rooms who do the sexual assault kits, are they familiar with this option? Yes. So for example, here in Winnipeg, the Health Sciences Center houses the Sexual Assault Nurse Examiner Program, or we refer to them as the SANES. They're absolutely aware of this option. And they also generally go over that with folks. People who do present at the Health Sciences Center also have the option of requesting a sexual assault crisis program advocate, so someone here from Klinic to be able to support as well. And our folks are trained here to be able to share that option with them as well. No problem at all.
Do you have more questions for Jaymie? Yeah. So Jaymie, this is a really good presentation. You gave us, the knowledge and really good full understanding what is your services and the program provided to the supporting and the victims, Yeah, I find, this is really great for people in Manitoba should know about your services. Yeah.
Mhm. Thank you so much, Tiffany, and thank you so much for all the folks who are participated here. Leanne said, I had no idea that this existed. I really appreciate this knowledge that I didn't have before. I'm excited to be an advocate if ever put in this situation to hear someone's story. Thank you so much, Leanne, for that. And yes, like we talk about third-party reporting, like as I mentioned earlier, this was only started in 2018, so it's still something that's very new and that folks aren't aware of. But yes, we definitely want folks to be aware that this is definitely an option. Karen said, is more information on how to access third-party reporting available on the Klinic website? Yes. So like if you go under the sexual assault tab, there's more information on third-party reporting there. And if anyone is ever if you're ever unsure or have a question about third-party reporting, always our crisis lines are always able to answer that, and they'll be able to direct you appropriately. And typically it's to me, and I'm always available for questions. Lorraine said, is there a 24-hour phone line to leave a message? Some clients are limited when they can access John Howard or the Women's Resource Center. So thanks, Lorraine. So unfortunately, I can't answer about those other places, but my phone line, they can leave a message at any time and I will get back to them as soon as I can. So whether that be if I'm not able to support them, for example, in filling out a third-party report, I will get back to them as soon as I can and provide them with that information so that they can do that. And the sexual assault crisis line and the Klinic crisis line are all 24 hours as well. So they're always able to at least speak to someone if they have a question. Thanks, Lorraine. Any other questions? Oh, yes. So the sexual assault crisis line number, which is 24 hours that they'll be able to reach someone, is 204-786-8631. However, my number, which is the number folks would want to book if they're wanting to do one here at Klinic, is 204-784-4049. So that is the number directly to me, and they're able to leave a message at there anytime. And like I said, I'll get back to them as soon as I can. So I'll type that here too. Or Tiffany, are you able to write that in there? My phone number is 204-784-4049.
Oh.
Perfect. Yeah. So that first number, the 786-8631, that's the sexual assault crisis program number that's answered 24 hours. They'll be able to speak to a person directly. The 784-4049 number, that's my number specifically. And during the weekdays, I'm able to answer within the day. But if it's hours outside of kind of 9 to 5, they can leave a message and then I'll get back to them in the morning. Yes. Thanks, Tiffany. Any other questions? I'll just give folks just a moment. Yes, so Karen says, we've had people ask about how they know something is considered sexual assault. Can you elaborate? So that one's a little bit of a nuanced answer. So for example, here at Klinic, when we talk about sexual assault, we talk about it in a trauma-informed way. So we kind of look at that as an umbrella term where it can go from catcalling or inappropriate sexual comments, all the way to what people consider what is sexual assault under the law. So under the law, sexual assault typically has to have some sort of like physical contact with a person. And that's typically what the third party reporting does, is that when the person goes to their questions, it talks more about kind of like the physical aspect of the sexual assault. But here at Klinic, we're able to support folks who kind of experience that wider range of what we call non-consensual sexual contact or sexual assault. So we're able to support folks in that way, or at least talk to folks. So that's why kind of having a conversation with us to kind of just get a general understanding of what it is that they're wanting to do and what they're hoping with the third party report is super important. And we provide that information at all various steps. Yeah, no problem at all, Karen. Any other last questions? So maybe while I'm waiting for like if there are any other last questions that come up, I basically want to extend again a thank you to everyone who participated today. Especially with kind of gaining this increased awareness around folks feeling more comfortable around who they can reach out to, as well as like where they can share their story, I think has been quite impactful. And having people who are informed about what it is and having that trauma-informed perspective and having that validation can be super helpful as well. We always tell our folks that typically the first person that people will share to, that person's response and that person's reactions can sometimes dictate, how that person will reach out for help or support later on. So being able to be curious, aware and knowledgeable about this kind of stuff can be very helpful. So again, I want to thank you all for participating today to increase your knowledge about this kind of stuff.
Yeah, and also on behalf of the Occupational Health Center, we appreciate, Jaymie spending an hour with us to give us this really full, in-depth information. We learn a lot from you, for so many people haven't heard about your program and the services. I find, this is great recap to positive to anyone is beneficial too, right? So, yeah. And also thank you all of you, the participant will be spending time with us this morning. So the session has been recorded. We're going to share with you later on and also with the slides. So yeah, and I think, there are no more questions. Probably we could wrap up the session this morning. Yeah, okay. Thank you again for everyone. Hope all of you have a great afternoon and great week. Bye.
Bye. Take care.
Take care.